Welcome to another episode of Doctor vs. AI with me, Dr. John Stelmach. I'm an orthopedic surgeon. I have 40 years of experience almost in orthopedics, 34 years in private practice, and I do hip and knee replacement as my specialty. And the way this works is I'm in my Cybertruck doing nothing, self-driving safely, watching the road. Cars taking care of that for me, so I'm kind of bored. So what we do is we sit here and have a discussion with AI about topics that I'm sure my patients want to know about. And the one thing that patients get very concerned about, and when you start asking the computer instead of waiting to see your doctor, is if you had surgery, say on your hip or your knee, and you have, after surgery, it kind of hurts and you're scared and you don't know what's going on and you have some pain and is it swollen? Do I have an infection? I mean, you talk to your friends and they tell you all these horrible things. So let me just see what the computer says, and I haven't asked the computer yet to see what it's going to say. And in my car, I have an AI assistant called Grok, so I summon her, and let's ask her, and I'll pretend I'm a patient. So let's go. Hey, Grok, I just had my knee replaced 2 days ago, and I'm home, and now it really hurts a lot, and it's pretty much, and it's red, and I'm worried I have an infection. What should I do?
Call your surgeon or doctor right now. Redness and bad pain 2 days after knee surgery could mean infection, and they need to check it fast. If you have fever, chills, swelling, or drainage too, head to the ER or urgent care immediately.
Well, that's not a very helpful answer. I mean, that's the kind of stuff you're going to do anyway. A day or two after surgery, when you get home, because a lot of times we used to keep people in the hospital for 5 days after surgery. We don't do that anymore. A lot of times you go home the morning after, or even the same day occasionally. So it's not unusual to be home for a couple days and start having pain, and you don't really know what to do about it. And some of the things to think about is, number one, if you are really concerned, give a call and talk, and we can quickly assess if it's something that we need to look at acutely or it's part of the post-op procedure. But one concept that people don't understand is that when we do the surgery nowadays, we do the operation and we put a lot of numbing medicine around the knee joint. And that numbing medicine often lasts for a day or two. So when you wake up from surgery, you have had a spinal anesthesia, your knee doesn't hurt. I put medicine around your knee and that makes it feel good. So you really don't have a lot of pain in the hospital, and people think it's kind of a piece of cake. Then when you get discharged, you go home, you're on some pain medicine, and you think, oh, this is okay, you're gonna get up and you're gonna walk and you're gonna do some things, and oh, it's great. The problem is when the numbing medicine that I put in wears off, then it starts to hurt, and all of a sudden now you're getting pain. And you get scared that there's something wrong. And also, knees after surgery, when you cut yourself, you see how it gets red in a couple days. You don't have a lot of inflammation initially, it's just the cut. But in a few days, things get red because the body is kind of reacting to things. So the most likely thing to have happened to you is that your medicine wore off, you're getting increased pain, and then the knee's a little red or hip's a little red because it's healing. Now, things that are a little different is if you develop a fever, you have redness that's getting worse and spreading down the leg. There's drainage, which is not just necessarily blood, but it's drainage from the knee, which is clear or cloudy, or what they call purulent, which is pussy. That's the kind of thing we really worry about. So the big thing is to try to get ahead of that even before it happens. So you're looking at this video, you probably had surgery and did do some of the things, but it's important when you go home to ice and elevate your knee and kind of rest, and when the pain happens, take some pain medicine. But a lot of times the symptoms that you're having, increased pain and some redness after surgery, is really pretty much a normal part of it. But if you're concerned, it doesn't go right, you should call your surgeon. If you can't get a hold of them, you can go to the emergency room. We try to discourage that because they're not really, they're there to put out emergency fires. And I've had multiple patients admitted to the hospital, told they have an infection, and really what they have is just a knee that had surgery. Infection rate in knee and hip replacement is probably about 1 out of every 200 people. So the chances are that you really don't have an infection. But again, you should talk to your surgeon or the on-call person and figure out if that's something we should consider. But the big thing is realizing that some of this is normal. And hopefully that gave you some information. And again, this is another episode of Doctor vs. AI with myself, Dr. John Stelmach, and hopefully we'll do some more of these episodes and answer some more questions for you. Nice to see you, and see you in the next one.